The Newsday continues here on One News Now. I'm Riza Diaz. Not only are COVID-19 infections on the rise, but also the number of expecting Filipino mothers. How will COVID-19 impact their pregnancy? Giving us more details, Faith Del Mundo is reporting to us live from Quezon City. Faith?
Yes, Riza. Well, pregnant women are deemed not more susceptible to COVID-19 than the rest of the population. Health experts warn that the complications will be severe should they be infected with COVID-19. In Laging Handa public briefing, Dr. Sibyl Liz Ann Bravo, OBGYN, from the UP College of Medicine said that pregnant mothers should have limited face-to-face consultation with their healthcare providers, especially during the first trimester or the first 3 months of their pregnancy. Bravo said the time to meet the doctor face-to-face will be towards the due date. Even then, she said it should be on an appointment. She clarified that if the expecting mothers has a comorbidities, it will be a different scenario. The doctor said pregnant women are at the same risk of getting infected with COVID-19. However, when they do get infected, the complications may be severe. This includes low birth weight or preterm or premature delivery. Bravo said there is also a small chance for the mother to pass the virus to the baby while in her womb. After delivery, a mother who is COVID positive is still encouraged to breastfeed her baby. This is so she can pass antibodies to her child through the breast milk. Riza, health experts remind expecting mothers to stay at home as much as possible. They are also taking an RT-PCR swab test as the due date draws near, and it is required if giving birth in the hospital. Riza?
Faith, what about getting COVID-19 shots? What do experts recommend to expecting mothers about this?
Yes, Riza, pregnant women can get COVID-19 vaccine with precaution. Given there is only a limited data on pregnant women from clinical studies, it is actually advised to get the vaccines after the first trimester or the last trimester of pregnancy. However, because of the limited supplies here in our country for the vaccines, they are actually encouraged to be vaccinated after delivery of their baby. Just make sure that they are not COVID-19 positive, or if they get infected, as per DOH, they should have 14 days after quarantine, they can be inoculated with the COVID-19 shots. Riza?
Well, thank you for all those information. That's Faith Del Mundo reporting from Quezon City. The Anti-Red Tape Authority, or ARTA, is set to issue a joint memorandum circular to cut down the regulatory requirements of local manufacturing of COVID-19 jabs. The memo will mandate the creation of a green lane to facilitate the expedited permitting process. ARTA Director General Jeremiah Belica says it aims to standardize the documentary requirements, steps, and processing time. This is expected to declog the FDA of responsibilities since the bulk of decision-making on registration processes comes from this agency. Australia bans passengers from India, including even their residents and citizens. Authorities said the new measure will take effect on Monday, May 3. Violators will face fines and up to 5 years of jail time. This is the first time Australia has made it a criminal offense for its residents to come home. This as India faces a devastating second wave of COVID-19. Now, as many hospitals continue to struggle amid the COVID-19 pandemic, plenty of people have been forced to find treatment from their own homes. But in this scenario, how does one prevent COVID-19 infection to other family members? The World Health Organization answers that in this report.
If you're infected with COVID-19 and have been asked to care for yourself at home, or if you're a caregiver to someone who has COVID-19 and are caring for them at home, how would you keep everyone safe? Hello and welcome to Science in 5. I'm Vismita Gupta-Smith. These are WHO's Conversations in Science, and Dr. April Baller is going to explain to us today how to care safely for a COVID-19 patient at home. Welcome, April.
Thank you, Vismita. Nice to be here.
April, what are the scenarios we're seeing where a person is being asked to care for themselves or take care of a COVID patient at home?
So the first scenario is when the health system is stretched. This happens when there, for example, is a sudden increase or surge in cases in the community, as we're seeing right now in many countries, and the bed capacity within the hospital is almost full or at full. It means that there's hardly any beds left. In this case, what the doctors may do is they might see a patient and give them the treatment and advice, and then discharge them to be taken care at home. The second scenario, which is the ideal scenario, is when patients test positive. However, they don't have any symptoms, or they have very mild symptoms, and they don't have any underlying diseases like cardiovascular disease or chronic lung disease, and they're not elderly. So these people can be taken care of at home. However, they must importantly first contact the health care provider for real-time advice.
So in a scenario where you have a person who's infected with COVID at home, how do you keep them and yourself safe?
The first and important point is that the person, the patient, should stay in a separate room. If this is not possible, then they should have a designated part of the home, and their movements around the house should be limited. Also, there should be kept 1 meter, at least 1 meter distance between them and anyone else. Secondly, it's critical to have good ventilation in that patient's room and any shared spaces. So this means to really have fresh, clean air coming through as much as possible. And this can be done just by opening the windows. Unfortunately, though, obviously needs to be safe to do so. Thirdly, there should only be one person who is the caregiver for that patient, and that caregiver should have no underlying conditions. Fourthly, whenever patients receive care, they should wear a medical mask, as should the caregiver. And as soon as the caregiver leaves the room, they need to make sure to wash their hands. Also, the patient should have their own designated or personalized, if you want to call it that, dishes and cups, towels, and bed linens. And these can be washed with soap and water at least once a day. Also importantly is any frequently touched surfaces by the patient have to be cleaned and disinfected every day. And any waste generated from that patient should be packed safely. And finally, unfortunately, there should be no visitors allowed during the time that the patient is ill.
And we'll be back with more stories after the break. Keep it here on One News. Riza Diaz. On Labor Day, President Duterte vows to provide security of tenure and protection of workers' rights. Duterte, who has a little over a year left on his term, assures the public that the government will do its best to commit to statutory labor standards. Vice President Leni Robredo says apart from gratitude and praise, what the country really needs are concrete actions on long-enduring labor issues such as contractualization and employee abuse. She also underscores the importance of providing enough cash assistance, efficient transportation, and a safe workplace during the COVID-19 pandemic. Now, here are other Labor Day stories we're keeping our eyes on. As businesses continue to reopen, the Trade Department says above 90% of these establishments have been compliant with minimum health protocols. Undersecretary Ireneo Vismontes says these businesses have been following protocols such as wearing a face mask and shields, physical distancing, and sanitation. The IATF has recently allowed more establishments to reopen under the extended modified ECQ. Senator Laila de Lima has filed a measure seeking to ensure the welfare and protection of business process outsourcing or BPO workers in the country. De Lima says the heaviest burden that has been hounding the BPO workers is the lack of protection and support from the government. Now, under the proposed bill, the welfare of BPO workers will be protected by addressing the legislative gaps in existing labor laws. And the Tourism Department reports that some 465,000 displaced tourism workers have been approved to receive a one-time financial assistance worth 5,000 pesos. Secretary Bernadette Romulo Puyat says the aid will be given through the agency's cash assistance program with the Labor Department. The funds will be sourced from the Bayanihan to recover as one law or Bayanihan 2. Now, for more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.